Hello, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about the low histamine diet. And that diet is a little bit controversial because low histamine foods are very much dependent on the individual. In other words, histamine foods are tolerated in some people and other people are not. So, for example, fermented foods. In general, most MCAS patients can't tolerate fermented foods. So things like sauerkraut, yogurt, kefir, kombucha, kimchi. Generally, MCAS patients can't handle that. But other foods like miso, ham, sausage, raisins, cherries, mangoes, apricots, pineapple. It really, really is an individual sort of a food sensitivity or allergy. It is not across the board. So if you were to Google high histamine foods, you'd get a list of these foods, but not all of them are going to be offenders to you. Some of them will be, most likely the fermented foods and the processed foods, but not all of them are going to be. So it's not that helpful to Google a low histamine diet because it might not resonate with your particular being. So what I would suggest is to take out fermented foods, take out processed foods, and then the other foods, introduce them one at a time and see if you have a reaction to it. And if you do, then for you, that food is a high histamine food. It is not correct to tell patients to go on a low histamine diet and expect everyone to respond the same way. It's just not going to work. And that's because, histamine affects everybody differently. And in some people, it's much more pronounced. In other people, it's sort of a mild intolerance. And so what are some things that you can do to modulate the MCAS reaction? Well, one is to use histamine modulators, things like cromolyn sodium, ketotifen, Singulair, Allegra, pepsin, or Pepsid. And then for the natural things, you can use Hist-DAO, you can use quercetin, bromelain, luteolin, polyphenols. Also, vitamin D with K is also very helpful in modulating the histamine response. And flavonoids like quercetin is really great for modulating the histamine response. And LDN, low-dose naltrexone, is an immune modulator and can be very, very helpful in minimizing the histamine response. So, a combination of using histamine modulators with vitamin D and K, curcumin, polyphenols like quercetin, and low-dose naltrexone, coupled with drugs like Allegra, Singulair, Pepsid, cromolyn sodium, and ketotifen can be very, very helpful in helping to minimize the extent of the histamine response. So I hope you find this information helpful, and I hope you have a wonderful day. Take care.